Bismillahirrahmanirrahim. Assalamu alaikum. Hi guys, this is Dr. Ghufran Babar. Today's video will be on the application process, how to get the residency in US, the interview questions, and the match itself. So please like this video, subscribe to my channel, and see my other videos on step 1, step 2, CK, CS, and step 3. As we go on this journey, we started with the step 1, then you guys did step 2, CK, CS, and step 3. Probably some of you may not have done it right now, and is the time for applying for the residencies. So first things first, you have to figure out which are the fields that you're really interested, and whether you are interested in one, or you could be interested in more than one, like internal medicine, or you could be interested in emergency medicine, family medicine, or you could be interested in psychiatry, pediatrics, or surgery. Surgery residencies are harder to get for IMGs, same as with dermatology, anesthesiology, radiology, unless you have had good rotations and you have excellent scores. So after selecting your field, you have to find out which programs I need to apply, because the application is very important, that you send that application to the right residency program, which will be the best fit for you and for the program itself. Generally for IMGs, Northeast, Chicago area are preferable, as well as areas towards South, Arizona, in those areas. New Mexico could be another favored area. Northeast includes New York, New Jersey, Philadelphia. You can go to Connecticut, Maryland, and down to Virginia. So those are the states. Massachusetts, sometimes you can get residencies there. And then Chicago, like I said, the bigger city. California is hard. It has got its own laws for licensing. But Arizona, New Mexico, they could be a better choice as well. And it also depends on your scores, which are most important thing. So after you select the programs, you can apply to university programs if you have done rotations there, and there is a website which is called Match a Resident that can guide you to give you the list of schools where you can apply as an American medical graduate or an IMG or international medical graduate. So once you figure out the list, so that website may ask you what are your scores, what is your years post graduation, whether you have done electives in US or not, and any other research experience that you have, and will give you a list of programs to apply. So once you apply, then most important thing, if there is off the bat, is your score. The scores that they may use is your step 1 score. The reason is that step 1 gives the knowledge, the baseline knowledge. Sometimes they may use the step 2 CS as well to screen out. Some programs may only hire the American graduates or American citizens or American green card holders. So they may have filters in their programs to find out which are those people. But off the bat, which things are in your control is your scores. Any scores above than more than 250 are really, really good. But if your scores are around 200 and 220, that will be kind of a hard thing for you to get matched. A lot of people, about 15,000, and maybe always increasing the number of applications which are being received. The better your scores are, the better your chances would be. So whatever you have done is gone. So now it is the application process. So if you have greater than 5 years of gap in between your med school graduation and current status. Sometimes doing masters in public health or some other degree in US may help to cover up the time, that is the years of graduation. The other thing which is important, that don't leave any gaps in your CV. And if you are saying, oh, I prepared for step 1 for 6 months and didn't do anything, sometimes that doesn't go well. You may want to show some clinical attachment or something, or research, so that they would not say, oh, this guy would take 6 months to prepare for step 1. What about if you have to take up the board for the internal medicine? So what's going on? This guy takes so long to study. When you have 2 months after the end of your residency to take the board exam, would this guy pass the board? So that is very important. So the years since graduation and how long did you take to prepare the exam is important. And if there are any gaps, you should have a good explanation for those gaps. As more and more applicants are coming, they have seen that people who have done step 3, although it's not expected, they expect you to clear step 3 at the end of intern year, or you can clear the step 3 at the end of the second year. Sometimes programs make sure that it is mandatory that you clear the step 3 exam before the end of the second year. So if you have done the step 3 and you have taken the advantage of coming to US for the interview season, just go ahead and take your step 3. Make sure you have prepared it well, because if you take a good score, greater than 220, that is really nice. And low pass is still reasonable, but if you fail step 3, that will not go well. So step 3 may be a pivotal thing if there is something that some programs screen application. I know where I was trained in New York, they screen the applications based on the step 3 passage or not. If you have cleared the step 3, you are automatically shortlisted. So step 3 is a very, very critical thing that you may want to do. Regarding the clinical attachments and rotations, it's very much advisable to get the hands-on experience. If you are doing an externship, there's some programs you can Google, you can search, that can give you the paid rotation as well. So if you don't get, because these rotations, these externships are less and less. So the more, better chance for you to get an interview would be to do an attachment with hands-on experience, history taking, presentation, like a sub-I would be really, really nice, even if you have to pay for it. Your medical school is very important, because if your medical school is a school from where people have hired, they're familiar with that medical school, your chances of getting an interview is very good. So you can always ask your seniors where they have gotten matched, or you can ask your med school where people who have done this, who have come to US, which programs have accepted them. So try to apply on those in those programs. And if you have a senior there who is third year resident or is a chief resident, they can also be your advocate. Or if there's an attending who can send an email on your behalf that, okay, this guy is coming from my program, I know this guy, or this guy has been recommended by my professor with whom I have also trained, and my professor was a very nice person. So those things, and highly trust that professor. If this professor is recommending this guy for residentship, then you should please consider for an interview. Location, if you are based in US, then a location which is close to you guys where you are living. If you are a green card holder, that would be really useful. Make sure that your CV is good, especially for those people who are older guys who have more years since graduation, or they're repeat applicants, they have not matched. Make sure you highlight your things, do a rotation, get attachment in a good research program, and that will improve your chances of getting matched this year. Make sure that you are doing, if you go back to your country after interview season, you didn't get matched, you make sure that you do a clinical rotation with getting more hands-on experience for your match this year. And regarding your letter of recommendations, make sure that the letters of recommendations are coming from someone who really knows you. So you're applying in pediatrics, at least 2 of your letter of recommendations should be from attendings in pediatrics. If you are doing rotation, if you are doing internal medicine, at least 2 of them. And when they write those letters of recommendation, they should not be generic. Sometimes there are specific words that they use. You need to find an attending, a professor who knows you really well, can explain your strengths, and if there's any weakness, they can tell. Most of the letters of recommendations don't highlight or don't mention it, but at least tell, oh, he was good in debates, he was good at rounds, he was very responsible, he used to come on time, and the colleagues were really happy, or there were the paramedical staff was happy with them, he went along well with those people. So those are the highlights you have to tell to your professor to mention that, to improve your chances in residency and getting a residency. Then community programs, if you have done any volunteer work, that would be nice. Like I said, hands-on experience in US is really good. If you are a green card holder, if you're a US resident, your chances are higher. If your spouse is an attending or is a physician, they have higher chance. But if you don't have those things, make sure that you have a good letter of recommendation. So those letter of recommendations, your CV, and then your personal statement. So highlight the personal statement, experience, why you became a physician, why do you want to become a psychiatrist, why do you want to become a pediatrician, why do you want to go into surgery. So make sure that in personal statement, you really highlight your interest in that specific field. Usually the question is, how many programs do you apply? As IMGs, it's a very expensive expedition. So you may want to focus on the right programs, whether they are community hospitals, they are university programs. Just make sure that you don't apply in too many programs. If you are interested in 2 or 3 fields, just limit to that. And focus on your letters of recommendation, personal statement, CV, so that you have the right letter of recommendation. It would not be advisable to send a pediatrics letter of recommendation for internal medicine. If you have experience in pediatrics, unlikely that you will get an interview in internal medicine. So at least 2 letters of recommendation. And the third letter of recommendation, if it's not from your field, at least that letter of recommendation should explain your strengths, really from someone who really cares to write for you a good letter of recommendation. Once, regarding the externship, it's really hard. It's not easy to get those externships. Like I said, a lot of people want to get in them. But if you have done good externship, that really helps you. And if those people have seen you, the interview committee, once your application comes up, they say, oh, I know this person. He has really done a remarkable thing during 3 months of rotation or 2 months of rotation. And if they can give you a nice letter of recommendation, that will go a long way. Make sure, talk to people in that program if you know someone, and see who are the people who will be interviewing you once you get an interview, and try to learn about the program, try to learn about those people who will be interviewing you. One of the things, the most important thing is, once you have gone through this process in September, then you wait for the interviews. They will look at your application and they will decide If late October you have not received, you may want to send them an email, remind them that I'm interested in your program. And if they have overlooked your application, they may want to look at it. When you call, be very nice to the people, that is the program secretary, because they will note. The last thing you want that you were not nice to that secretary, and she will make a note of it and may tell the program director. If you're sending an email to the program director, be very nice, be very caring. Make sure your spellings in that email are good. It is well worded. Same is with the personal statement. It is a lot of times, program directors don't have time to read the personal statements. But when they do read, make sure that it is seen by someone else. You have gone through the grammar, you have gone through the spell check, so that it is a really nice personal statement to look at. They may look at your personal statement just before your interview. They may look at your CV. So avoid the gaps in your training, as well as make sure that your personal statement is really nice, because some people may read it. And if you have not gotten a call from the place where you applied, you may want to contact the chief resident or a senior colleague who is a resident there. They can mention your name, or an attending in their program. The other thing is that if you are coming from a place you want a visa like H-1B visa, you need to pass the step 3. And remember, it is very expensive for the programs to sponsor H-1B visa versus J-1 visa, or someone who already is a permanent resident or a citizen. So you have to make sure, if you have got good scores, you have done rotation, your CV, personal statement, everything is nice, so that you would be regarded high when you go in for the interview. So your interview starts right before, as soon as you start the application process, because you are coming in contact with your program director. You will talk to your program director secretary. You're nice, they may mention you. When you come for the interview, make sure that you know the locality, come there a day early, try to drive there, go to the location, see where it is, and you make sure that you have found the place you would be interviewed. When I went for the interview, I focused say I had interviews in New York, so I made sure that I staggered those programs during that 1 week that I'll be interviewing, to decrease the cost of travel and lodging. So I would go for an interview to one place on one day, next day another one, and so on, so that I do 3 or 4 interviews at one location. And I used to go there a day before, look at the department, location, so that on the morning of the interview, I am not confused, I don't get late, I'm not anxious, I feel relaxed, I know where to go. So those things really help. Some places will offer you a dinner before the interview, which will be informal. You can ask questions from the residents. Make sure you don't focus on too much eating. I don't drink, but some people may want to drink, but make sure you don't drink too much, because that will be a negative effect. You may lose your mind, so that will decrease your scores of getting a residency. And these residents who will be on the dinner, they will report how you behave. So ask good questions about the program. What is the salary? How is the program? What is good thing about the program? So what's the weaknesses of the program? Some residents may be honest, and they will be able to give you that knowledge. So on the night of the interview, you make sure that you press your clothes, make sure you find nice clean tie, clean shirt, your suit is pressed, your shoes are polished, everything is arranged, your bag is ready. In the morning, you wake up, have a nice breakfast, try to wake up at 6 a.m. and by 7 a.m. you should be out of the door. Try to select a hotel which is not too far from your interview place, or should be in the middle of 3 or 4 programs where you are interviewing. Try to be there 30 minutes in advance. When I was interviewed, the place where I did my residency in New York, I got there 30 minutes ahead of time. I was the first one to get there. And guess what? The program director comes in, and there were like 10 or 15 people that were interviewed that day. And what is the question that he asked? He asked that who came first. So of course, I stood up that I was the first one, and he interviewed me. I was the first one to be interviewed, and guess what? I got matched in that program. So those are the things that you have to really focus on. The red flags in your application could be large gaps where you did nothing. Hope that you did not stop practicing medicine. Or people who get married, they stay at home for a few years, especially the female candidates. So you have to explain that what you did. And if you can get a clinical attachment, that would be nice. You should have a good explanation. They're going to ask you. And the negative thing, God forbid, you are not in trouble with the law. And when you go in interview, the first 30 seconds of your interview are the most pivotal. They will really determine whether you're gonna get this residency. So other than your scores, other than your CV, other than your experience, other than your personal statement, you are your own advocate. You are your own ambassador. You go in, have a smiley face, have a confidence, positive attitude, smiling with every answer, not being confused. So practice your interviews, practice with your friends. So those 30 seconds will determine whether you get the residency a lot of times or not. So you have to be very pleasant, answer the questions, and be very nice. And make sure you answer questions well, and be positive during your interview. Even your scores are not good, you still will be counted. You may be asked about the US experience. If you had one, you can explain where you worked. They may ask you why are you applying to this program. So you have to have a good reason why you are applying to this program. They may ask you you are applying in internal medicine. Why do you like internal medicine? You have to explain that, okay, something happened in my life, or you can explain a case, but they will ask you, why are you applying in internal medicine? Why are you applying in our program? You may mention the location, that it is, New York. I like a big city. I come from a big city. I like, a city where I could have some time to enjoy, to look around. So they want to understand that you are a normal person. So they may ask you about your research experience, and make sure your research experience is really nice if it came out with a publication. So there's nothing bad with the research application that was associated with with a publication. Or if you have done a year worth or 2 years of research, they want to be sure that you are more humane. If you are working a basic science lab, you are out of clinical touch. So that is very important. If you have done a couple of months of rotation after that research experience, so that can go into your good in terms of your application. Paid rotations are very good. If you get paid, you are a sub-I. That really goes a long way in your success towards your application. So make sure that you have some questions. They may ask you, do you have any questions for us? You make sure you are prepared with those questions. What questions are you going to ask? What was the best thing in your program which has happened in last 5 years? What are the strengths of your program? What are your weaknesses? On the other hand, they may ask you, what are your strengths? Why should we hire you? Or what are your weaknesses? Make sure if you mention your weakness, mention in a positive way that I am a perfectionist, I want to do things well, that is my kind of a weakness, but that may be your strength as well. And when you bring out your strengths, don't bring down other people. Oh, in my program, I was the smartest guy, I used to come. So don't brag. Try to be down to earth, still highlighting your good points. So those are really good things in terms of your interview. So like I said, be very confident, and your English speaking skills are really important. So for people who have accents, make sure you speak slowly. So I will repeat, if you have an accent, English is not your first language. First language is, Hindi, Urdu, Chinese, Thai language, Philippines. Make sure you speak slowly and clearly so that your program director and the interviewing people would be able to understand you, and they would know that, okay, if I can understand this person, probably the patients would be able to able to understand you. They may ask you, tell me about yourself, then make sure you describe yourself, from where you come, where your medical school was. You can tell something about your clinical experience, your family, your interest, your hobbies. They want to hire someone who's a normal person. So you tell, okay, I like to play cricket, I like to watch cricket. So they would understand, oh, I like to watch movies when I'm free, so that they know that this guy has something else as well in his life that he enjoys. Oh, I like to play and spend time with my wife, with my kids. So that they know that he values the family. I would like to settle down in New York. You can tell them that, okay, I love New York, I love New Jersey, I love Chicago, I want to settle down. So they know that once this guy will graduate, he will be able to serve the local community. So that is another thing. Again, you may be asked, tell us about your best boss, about your bosses. How were they, or the worst boss? Was there any problem with your worst boss? How did you fix the problem? And how would you get along with a person who is not nice? So those are the things that they will like to see, insight into your personality, whether you're a team person, you're reliable, persistent, you work hard. Make sure you understand the competencies, the AAMC competencies, which you will be knowing, the value of being responsible, caring, the patient confidentiality, all those things you should know. The mission of the hospital. So learn about the mission of the hospital, that, okay, this hospital wants to serve the poor and the needy, underserved area, and I come from an underdeveloped country. I want to serve people. I really feel pleasure in helping other people. So those things really go a long way. And they, like I said earlier, that they will ask, why should we hire you? We have thousands of applications. So you have to highlight and sell yourself. So in the interview process, not only the program is selling itself, you are also selling yourself. So they want to know, why do we want to buy or hire you? So you highlight your personality, and your personality is your first signature or stamp on getting a specific residency. The way you talk, the way you move, you should not interrupt the interviewer, and you should highlight your personality, that, I was a successful debater, I work in charity, I volunteered, I have a deep sense of belonging with the underserved people, I want to take care of the needy, medicine for me is a mission, I want to do it. My parents, they come from a humble background, and they have taught me good values to take care of those people who are really in need. So those things are really, really important. So, any questions for the panel or interviewer, that will be important. Show your interest. You should have gone over that program. You should have gone over the curriculum for training. You can ask about, what is your curriculum of your training? How do you train? They may explain the morning report. You can ask about what is done, what is the theme of morning report, what is the theme of afternoon report, what is the rounds like. If you have done rotation, make sure you are the first one to come in the rotation, so that they know that you are really responsible in terms of the timeliness. If you are new to the area, when they ask you what questions you have, you can ask about the area, which are the places to visit on the weekend, on your off days, what is the favorite place of the residents to hang around. and you can ask about the program director, what do you love about your program that you know that really is that makes your program a very good program compared to other programs. They may ask you about some rare questions, like some states have legalized cannabis. They may ask about those policy, alternative medicine, or physician-assisted death. They may ask you those controversial topics. Make sure you support your answer, that you're a religious person. You may not, be someone who may assist in death. There may be other options of treatment that may come up. So you make sure you highlight those things. Alternative medicine, you should not argue with those people who follow it. You just focus on your type of treatment. And cannabis is a controversial thing. You may not be someone who may like that because it may alter your mental status, affect your work, so on and so forth. But demonstrate your naturalness, your maturity, and professional attitude. Make sure that if they ask you about your specialty interest, why do you want to do this specialty, you have to have an answer, a clear answer for your psychiatry. If you've done a rotation, you had an experience with the patient, psychiatry programs are hard to get in. They make sure that you're really someone who's going to stick around and not run away. And then they may ask you questions which are long-term in terms of your personality, that where do you want to see yourself in 5 years, 10 years, where you're going to be local, you want to be, you want to do a fellowship, you may want to ask them how many people get matched in the fellowship programs. If you are interested in intervention cardiology, you can ask about that. Your interest, like I already said, outside work, what else do you want to know? Know your application and gaps. They may ask you questions about your application that you would be surprised about. So those are the things that really help you on the interview day. And make sure you email to your program coordinator, program director, thanking them for the opportunity of the interview. And then you may want to contact them a month later that, okay, I was interviewed, I really like your program, what do you think about me? They may or may not answer that question. Then you make sure that you are positive, wait patiently for your application. When you are doing your rank order list, some programs who really like you, they may ask you if you want to come back for a second look. You can go there, reassess the program. Most of the programs don't do it. When you do the rank order list, make sure you do the highlight or put that program on top that you really liked. Don't be scared that they may not match you. Put it on the top and make sure the process, the program specialty, you like the emergency medicine, make sure you put them on top. You like family medicine, you put them on the top. You select the program where you interviewed well, you think your chances are the best. There was someone who, called the program director for you, someone you knew you in that program. You make sure that those programs are on the top of your rank order list so that you get matched. And then wait patiently until you get matched. If you don't get matched, then there is also post-match. Sometimes people get matched in June. People drop out of the programs. Sometimes new positions come up. Sometimes people may get matched as late as July. So you keep on contacting those programs where you did not match, but you had interviewed them, so that if there's an option available, they will be able to contact. If you stay unmatched, a lot of people, up to 50% of people may stay unmatched. So if you stay unmatched, don't lose your heart, but be realistic. If you have taken multiple attempts to pass, there are multiple gaps, your year since graduation says more than 5 to 10 years, then you try to focus more on the weaknesses, make your application good, improve on your personal statement, do a rotation in a program, do a paid rotation, join a master's of public health program, do volunteer work, so that next time around you have a better better chance, of getting residency. Focus. People sometimes say, oh, I want to be in New York, I have a cousin there, I want to be in Chicago, I have uncle there, I have fiance there. So you open up your options next time. You apply to other areas because you want to get into your residency program no matter what. So open up, make sure you try to apply to other places. Do not apply to university programs only. Focus and highlight on programs which are IMG friendly. IMG friendly. So change the geography. If you have time, do the step 3. That will siphon your application away so that you will be highlighted. Okay, he had more than 5 years since graduation. He has score of more than 240 on step 3. He has really done well in step 3. Now he's ready to join in our program. So those are the things which will be. As every year passes, it's becoming harder and harder for the IMGs. More US graduates are coming, but don't lose heart. Stay motivated. Visa status, if you have you're looking for H1B, is harder. If not H1B, get the J1 visa. And those people who are taking the steps, advise them to score well. The better they score, the better their chances of getting into their residency. Revisit your letters of recommendation. Talk to the people who wrote you letters of recommendation. Be specific. Highlight your qualities. What are your strengths? What are your weaknesses, if there is any, that may not negatively affect your application? Scores really matter, but scores are a history. So the things which are in your control are your scores. So stay focused when you're preparing for the steps. Interview is important. Scores greater than 250 are really important, but the interview could be a make or break deal. First 30 seconds, like I said, are really, really important. So stay positive in every interview. Be happy. Don't show lethargic attitude. I had one person who had interviewed at 7 or 8 places, and he was, oh, I'm just here to see this program. No. You may not get matched in those 7 or 8 programs. You may get matched in this program. So you have to be positive and cheerful and show your interest in that program, because this may be the program which may accept you. So be confident, smile, be warm. Your handshake should be really nice. Look comfortable. Make sure you have taken a shower. Good hygiene. Well groomed. Look enthusiastic. Speak English clearly and slowly. Ask about the program. If they ask you question, if you know Spanish, apply in those areas where they want Spanish. Some areas Mandarin is important. They may accept you if you speak Chinese or Mandarin. So try to practice the interviews with your friend so that it becomes a second nature when they ask you all those questions that I have listed on this in this video. And I have covered most of the questions that you may be asked in your interview. So work on these questions. Please like this video. Give me any feedbacks. Tell me if there are any other topics you want me to make the video. Share it with your friends. Subscribe to my channel. And I wish you best of luck and hope you will get matched in the program that you really want. May God bless you and your family. Thank you. Best of luck. Sallallahu alaihi wa alihi wa sahbihi wa sallam. Thank you guys. Goodbye.